These Democrats, they have a letter that they send out to everybody about why they supported the health care bill. And in it, Melissa Bean says that there are no Medicare cuts in Obamacare. You can read my formal response to her by ordering and supporting the Great Patriots at the Conservative Magazine of Illinois. They've published it, my response. And in it, she says there are no cuts in Medicare. Senior citizens, please listen up. Please tell your people over at Del Webb who are still hooked on the hopium. These are the Medicare cuts in Obamacare. I'm going to read them in order as to when they are implemented. Medicare cuts to hospitals begin long-term and inpatient and rehab facilities, fiscal year 10. Medicare cuts to inpatient psych hospitals, 7/1/10. $132 billion to Medicare Advantage cuts begin 2011. You sign holders, look it up. Medicare cuts to home health, 2011. Wealthy seniors. Only a Democrat would say a senior is wealthy if he makes $85,000 a year, but that's the parameter. They begin paying higher Part D premiums. And by the way, it's not indexed for inflation. Oh, there's more. Medicare reimbursement cuts when seniors use diagnostic imaging like MRI, CT scans, and other nuclear medicine scans. Now, let me ask you a question. Dr. Brown is a great patriot, speaks with me on Joe Walsh's healthcare panels, and he will tell you that the reason that they are cutting diagnostic imaging like MRIs and CTs, when a doctor thinks you have cancer, what does he order for you? He orders some sort of diagnostic imaging, right? So if you cut diagnostic imaging for our senior citizens, then you won't find the cancer. If you don't find the cancer, you don't have to pay out big bills to control that cancer. That is probably the worst cut yet. But oh, there's more. Medicare cuts begin to ambulance services, ACSs, diagnostic labs, and durable medical equipment. Prohibition on Medicare payments to new physician-owned hospitals, 2011. Seniors prohibited from purchasing power wheelchairs unless they rent one for 13 months first. Thank you, President Obama. More Medicare cuts to long-term care hospitals, 7/1/11. More Medicare cuts to hospitals and cuts to nursing homes and inpatient rehab facilities. Medicare cuts to dialysis treatment. Dialysis. If you don't have a kidney, you need dialysis treatment. If you cut it, what's going to happen? Die. Thank you. Medicare cuts to hospitals with high readmission rates. Medicare cuts to hospice, 2013. Medicare cuts to hospitals who treat low-income seniors, 2013. More Medicare cuts in 2014, and more Medicare cuts in 2015. And the list actually goes on. I can't be up here for a half hour. So when Melissa Bean tells you, or any radical leftist statist tells you there are no cuts in the Medicare, please inform your neighbors. Go to truthaboutobamacare.com. Truthaboutobamacare.com. You will find every lie this president has told, every lie these Democrats have told, and you will find the truth so that you can talk to your neighbors, get them educated about how bad this legislation is. And you know, there's one other thing people aren't talking about, and it's a blessing for us. In 6 months, there's a part of Obamacare that starts, and we refer to in the industry as the MLRs. The MLR stands for medical loss ratios, or minimal loss ratios. And what those mean is, if you are a health insurance company, and you underwrite people less than 50, or you underwrite people who buy individual policies, you must now reduce your total operating revenue from 35%, which is the average, down to 20%. Okay, as of January 1st, because King Barry says so. If you underwrite 50 or more, then you must lower your profit margin from 35 to 15%. What does that mean? That means that we are going to lose health insurance companies. We have lost 5 health insurance companies since Obamacare was signed on March 23rd, 2010. One of them decided to pull out of every state. The company's called Guarantee Trust Life. And they're right here in Glenview on Milwaukee Avenue. You can drive right by them. Let me read you a letter they sent out to all my clients and clients around the country. The purpose of this letter is to provide you with information regarding your major medical coverage with Guarantee Trust Life. The letter is intended to provide notice of an action Guarantee Trust Life will be taking that will result in the termination of all major medical plans in your state. Will I be offered a replacement plan? Yes, you will. You can't drop somebody's coverage. It's a federal law in all 50 states. It's another lie from our president. Yes, we are required by law in the terms of your policy to offer you replacement coverage. The replacement plan will be a high-deductible major medical plan. A high-deductible major medical plan is a type of plan that doesn't begin to pay for anything until you've exceeded your brand new deductible of $25,000 per person. So these are people that have paid into their health insurance. For years, they've been faithful clients of mine from around the country, carrying $2,500 deductibles. Now they're getting an 18 to 23% rate increase, and their deductibles per person are going to $25,000. Why? Because when we demonize private industry, their only recourse to recoup those losses is to hurt the private policy holder. And that's exactly what's happening. eHealth out of Virginia, done. American National out of Texas, after 40 years in the business, done. Closed their doors. It's already happening, and that's because they have to become compliant by January 1st. But that's not all of it. I got one more thing to leave you, and then I want you to get to the polls. Get semi-trucks together, get all your neighbors, ride bicycles, I don't care. Because it's up to us to stop this legislation. This is the list of companies. Remember when Obamacare was first signed, we heard about a few companies that were going to take losses like Caterpillar, right? John Deere, AT&T. Lloyd's of London decided to gather together 80 companies who will now be taking millions of dollars in losses starting January 1st, 2013. Why? I'll read you Lloyd's of London's article. Very short. Starting in 2013, companies that provide prescription drug benefits for retirees under Medicare can no longer deduct this subsidy from their taxes, due to the federal health care overhaul signed into law on March 23rd. What does that mean in dollars and cents? You don't have to raise your hand, but when I do these health care panels with Joe Walsh, I always ask people, raise your hand if one of these 80 companies is in your personal retirement portfolio. So even your retirees who aren't working, you will be damaged by this. Let's see how bad it is. Walgreens, they're going to take a $44 million charge. I'm going to tell you something right after I finish this. I'm not going to read all 80. Unum, Provident, $10.2 million. R.H. Donnelly & Sons, $3.3 million. These are all names you know. You probably have in your retirement portfolio. Pfizer, Teco Energy, ITT Corp, $10 million, $7 million. Cummings Corp, $7 million. American Electric Power, Allegheny Technologies, 3M, Caterpillar, Merck & Company, and the granddaddy of them all, AT&T, $1 billion. Now, as I read those numbers, American Electric, $21 million, Allegheny, $5.3 million, $27 million for Norfolk, Caterpillar, $90 million for Caterpillar. We've all heard those numbers, but what nobody's talking about is those are first quarter losses only. First quarter. Can anybody multiply by 4? What do you think is going to happen when AT&T takes a $4 billion loss starting 2013? You think they might lay off a few people? Yeah. You think? This is how it's important it is, folks, to get to the polls in November. Educate your populace. Go to truthaboutobamacare.com. And please, it's up to us to stop the appropriations. If we can do that in November, we have essentially stopped Obamacare for all intents and purposes. And then God will look down on us in 2012, and He will put a conservative president into the White House. And you will see the largest tax cut in American history. It's up to you. God bless America. Thank you.